When I was visiting all these different areas post the earthquake during my job tenure, I came across a middle-aged man in one of the villages, and he had brought his 3-year-old son to the health post where I was going for my routine inspection and field visit. And he told me that he carried his son on foot and walked for more than 1.5 hours just to get a small bandage on his son's head because he had a wound over there. So that's just primary first aid service. And the guy, he was wearing basic sandals and it was really hot, and the child, he was bleeding from his forehead. So all these scenes just made me realize the kind of privilege that I grew up with. Whereas there were also people like those who had to walk for such a long time to get just the basic amenity of health service. I think it also made me realize the kind of social injustice and the level of disparities we have between people of different classes here in our country. And, there was this moment of self-realization that so many people are losing their lives and having to face an untimely death due to reasons as such, just because they were not so fortunate to belong to a privileged class with access to financial resources or health resources within their reach.
Hello everyone, my name is Din Long and welcome to the podcast Lifeline. In this podcast, I will interview people who are having a positive impact in their community and have a strong message that deserves to be shared. We will dive deeper into their journey becoming a change maker, and hopefully you can take away some insights for your own journey. And please do subscribe to Lifeline on YouTube, Apple Podcast, or any platform that you are using. And also you can share this episode with your friends if you like it. It's really what helps me the most. In today's episode, you will meet Neha Malla, who is a health activist on a mission to bring basic healthcare services to the furthest behind in Nepal. She is passionate about primary healthcare, maternal-child health and nutrition, and she co-founded SOCHAI in 2016, and it has been recognized internationally by UNICEF and One Young World. We go through the birth of SOCHAI, how the initial team with Bonita Sharma and Aasutosh Karki took action by creating the Nutribeads Bracelet, a low-tech product for pregnant women that informs about how to feed a child in the first 2 years of their life. And then we discuss how they scaled from this first product to actually support women, children, girls and families reach their full potential in life by improving their health and breaking the vicious cycle of malnutrition. Neha shares her eye-opening moments traveling to all the provinces of Nepal in the wake of the 2015 earthquake, where she observes a lack of basic health services and infrastructure. We discuss why it's important for her to have a very strong and transparent team, what are the small moments that help her discover her true purpose and make SOCHAI succeed. See you at the end of the episode and I hope you enjoy. Namaste Neha, how are you today?
Namaste, Din. I'm fine. How are you doing?
I'm good. I've been telling you that I received my new glasses. So yeah, I have these beautiful reflections on the screen. I'm super happy, super excited to have you on Lifeline podcast today. And actually, I forgot to tell you, but it's actually the first time that I have a guest that I don't know. Every time it's people I know already that I have met through work or virtually. I have worked on some product with them. So it's actually the first time I have a guest that I don't know. So it makes me also super happy because but Lifeline is also a way for me to meet new inspiring people outside of my own network. We were connected via Sagar, one of the amazing movers from Nepal, who really recommended you. So yeah, cannot wait to hear your story. And maybe would you start by introducing yourself, maybe what you're doing these days, where you come from, or anything that you want to kickstart with?
Thank you, Din. So my name is Neha Malla. I'm from Kathmandu, Nepal. And I'm currently leading a social enterprise called SOCHAI, which stands for Social Change Makers and Innovators here in Nepal. We basically work on the sector of nutrition, health, and menstrual hygiene management. So SOCHAI is a group of youth change makers. We train and empower youths who are from similar backgrounds to us, who are interested and passionate to work in the community and on the sector of health, nutrition, and hygiene. And yeah, it's been quite a journey. If I just look back across the years, and I'm actually quite excited that I'll be sharing it with the listeners of the Lifeline podcast and with you today. And yeah, like you mentioned, I did check out previous episodes of your podcast, and it's usually people who you've met personally or virtually till now. So today, I am the first one whom you didn't know previously or haven't met or been connected. But thanks to Sagar, who you mentioned before, we're here today, and I'm quite excited, and hopefully my story can move or inspire your listeners in some way. Yeah, that's what I'm hoping. Thank you for having me.
Thanks so much, Neha. So, yeah, for me, I don't really have experience in the health sector, nor in maternal childcare, or even working with children or with mothers. So, yeah, I think I really hope to learn from your story and from this interview today. So, yeah, really, really excited. Yeah, maybe just to kickstart about SOCHAI. So you guys do a lot of stuff. You have products, you have services, and you have awareness events. You produce low cost and low tech innovative products. So I saw all the bracelets. Well, let's kickstart with that. Would you like to share a bit about the bracelets? How did you have the idea? What is the impact of the bracelets? What did you hope to achieve through the bracelets?
As I mentioned before, through Sochai, we work on the sector of nutrition, health, and menstrual hygiene. So we came up with the idea of two innovative bracelets, which are quite simple actually. They're not high tech or engineered with some complex technology as such. They're just simple stone and glass beaded bracelets having different colors and numbers. So there are two bracelets that our team has created. The first one is called the Nutribeads Bracelet. So this bracelet has different numbers like 0, 6, 9, 12, and 24. And in between these numbers, there are different colored beads. So this bracelet is targeted for women who are pregnant and lactating, as in women who are breastfeeding their infants who are below 2 years of age. So this first 2 years of the child's age plus the 9 months of pregnancy. This period is called the golden 1,000 days of a child's life, the first 1,000 days. And what the child gets fed, what he or she eats, or the kind of nutrition that he or she receives is quite vital for the overall growth and development of the child. And also, it determines the overall health and immunity status of the child. That's why we focused on this golden 1,000-day period and created this Nutribeads bracelet. Between 0 and 6, the number 0 and 6, you'll find a white colored bead which represents mother's milk or breastfeeding. So it says that for the first 6 months, a mother should exclusively breastfeed her child. The child does not need any food from outside, as in not even water. The mother's milk is the complete nutritional source for the child's growth and development. And after 6 months, along with white, you'll find four more colors: brown, which stands for cereals and grains, that is the carbohydrate or energy giving foods; yellow, which stands for pulses, legumes, and nuts, which are plant source of proteins, the bodybuilding foods; third one is the green color, which stands for vegetables, fruits, your food sources for vitamin and minerals, which basically develops immunity power in the body. And finally, a blue colored bead. So blue bead stands for animal source of protein and fat, such as dairy products, meat, egg, fish, poultry. So all these foods that we consume on a daily basis. So, along with the mother's milk, plus these four core food groups, it comprises and makes up the complete nutritional source for the child. And it is also very vital for the brain development of the child, because almost 80% of the child's brain develops during the first 1,000 days. So that's why we're pushing this information through our Nutribeads bracelet. And what we do is we train young people, like I said before. These young volunteers who are associated with SOCHAI, they go to communities, health centers in the community, and they give the bracelets to the mothers for free and give them counseling of about 15 to 20 minutes individually to explain the concept of NutriBeads, why it's important to feed the child according to what the bracelet says. And we also do a follow up with the mother to whom we've given the bracelet, as in we take their phone number, their home address, and go back to their homes after a month to see whether they've actually kept the bracelet with them, and has it brought any kind of positive change in their knowledge, behavior, in terms of free breastfeeding or feeding their child in day-to-day basis. And as per a pilot survey that we did when we implemented the idea of the bracelet, we found that almost 83% of the mothers had increased knowledge and changed the dietary pattern or feeding pattern for their children. So we were quite happy and excited to see the result, because what our innovation did was actually create a positive impact. And even though it was a small step, I think it was the foundation to creating a healthy life and a nutritious lifestyle for the child. So this is how we came up with the idea of Nutribeads bracelet. We actually developed the concept back in 2016 when we applied to the Youth Innovation Challenge held by UNICEF and Pandemic Malaysia for the Asia Pacific region. And the idea of our bracelet won the first prize in that competition, beating 17 other countries. We won $5,000 as our seed grant, and that's how we started our work.
Oh, cool. I mean, I'm glad to hear that project from such competition is still alive and has so much impact. Thank you for sharing that. And I really love the low-tech approach. I just wonder, like, was this bracelet the birth of SOCHAI as well? Or were you doing already other projects?
Yeah, so this bracelet and the Youth Innovation Challenge is the basic step from where we came together and created SOCHAI. The four co-founders, we were friends and knew each other before, but we were working on different areas. But because we were applying to the Youth Innovation Challenge, we came up together as a team and developed the concept of bracelet. And yeah, that's how the journey of SOCHAI started. We actually started off as a loose youth network with the name Youth for Nutrition. And during our journey and evolving as change makers and innovators, that's how we came up with the name of SOCHAI after about a year and a half, I think. Yeah. So yeah, as you mentioned, I think the beauty of our bracelet and our project is that it's quite simple. It's self-explanatory, because there's a lot of education and literacy gap, especially amongst females and women here in Nepal. And since this bracelet is primarily targeted to mothers in the community, so it's really descriptive on its own, has colors and numbers that can be understood easily even by women and mothers who have not had the chance to get a formal education. So yeah, I truly believe on the famous quote by Steve Jobs that simplicity is the ultimate sophistication. And that's why whatever we do from SOCHAI, whatever projects or products or services that we develop, it's quite simple, quite understandable, but it goes on to create some lasting impact to the beneficiaries or to the people that we reach out to.
Thank you for clarifying a bit on the problem, on the issues that you realized. So I have a question, but it will sound a bit like when you are in a startup competition question. But maybe to contextualize things for me and for the audience, could you explain what is the scale of this problem Is it, I don't know, throughout Nepal? How big is it? Yeah, I don't really know much, so I would love to understand a bit more.
The problem of malnutrition and nutrition deficiency is quite prevalent in Nepal, especially in children who are below 5 years. And this period is also quite crucial for the child's overall lifespan and the health status of the child for his entire lifespan. So in Nepal, according to our National Demographic Health Survey that was conducted in 2016, it's conducted every 5 years. It was found that almost 36% of children below 5 years of age have the problem of stunting, which is a chronic form of malnutrition and cannot be reverted back. And you can just imagine, right? 36% is quite a large number. It means that 36 out of every 100 children are suffering from malnutrition in Nepal, a chronic form that cannot be treated or reverted back. So you can see that this will ultimately go on to affect an entire generation in terms of their health status, in terms of their capacity to earn or work, and thus this will go on to create a vicious cycle of malnutrition that needs to be broken if we want to create a healthier society that has a potential to achieve their maximal life goals or life status. So this problem has been really prevalent, and one of the major causes for such forms of chronic malnutrition to appear in children and infants is because their mothers do not have the proper knowledge, adequate knowledge about the kind of foods that she needs to feed, or even about the concept of breastfeeding and why it is so vital or crucial for the child's development. So, because malnutrition is such a pressing issue for the children here in Nepal, that's why we basically focused for the Golden 1,000 Days period. And thankfully, even though it's a small initiative, it has gone on to create some lasting impacts, and we've been receiving really encouraging and positive feedback till date to continue and expand our mission.
It makes me think a lot. These days I work a lot on the issue of climate change, and we always speak about, what are the actions that citizen can do, any citizen, to try to fight dangerous climate change. And I'm wondering, in the problem that you are addressing, the malnutrition for children less than 5 years old, what can, regular citizens do who might not be aware a lot about this issue? For sure they can support SOCHAI, but is there things that we can do in our daily life to try and contribute to solve this challenge?
Yeah, so obviously, every individual and every citizen has a part to play to solve the problems around them, around their community, in my opinion. So, you don't have to be someone from health background or someone from nutritional background to solve this crisis. As you might know, that there are many challenges in terms of food security or having ample or adequate resources of food around us in our community or in our homes. So what we can do as a normal person or a normal citizen is that maybe reach out to those people or those families who have difficulty in accessing these food sources, or maybe not just that, even telling mothers or telling the family members of pregnant and lactating women that there are these kind of resources or these facilities available nearby to their houses or communities, from where they can reach out for better services in terms of health, or help them to get opportunities in terms of employment or some sort of skills, so that the family can be dependent financially or independent financially to gain a sustainable source of income, so that their day-to-day food or nutritional sources can be fulfilled, and hence the health of the mother and child can go on to improve in the long term. So even though you might not be a part of SOCHAI, or you don't have to be someone who's a doctor or a nurse or a medical practitioner, just giving out these sort of information, or connecting those kind of vulnerable people with concerned authorities or stakeholders, in that way also you can play a part to combat the problems of malnutrition in your community. That's what I think.
And is that something that you always cared about, this issue? When you were younger, did you always, because we were mentioning like it's really your passion project and you are really happy to work on it every day. And I think it's super nice to hear that.
Yeah.
I just wondered if, is that something you wanted to do already when you were younger, to work on nutrition, on maternal health, hygiene?
Yeah, so as I was growing up, I always wanted to be involved in work that was related to health sector. As in, while I was growing up, there was this ambition to become a doctor, but I went on to study pharmacy for my undergraduate level. And just when I graduated from college, we had this massive earthquake of 2015, as you might recall. Yeah. So there were a lot of international projects and different health programs that started in Nepal post the earthquake. And that's how I got acquainted with different kind of health projects, as I got a chance to work with UNICEF and with the local government health body here in my home district. So during my work and tenure in the UNICEF project, I got to explore different areas within my home district here in Kathmandu, specifically called the Lalitpur. The area is called Lalitpur. So since I come from the capital itself, it's a quite urban area with all the facilities and resources available at your footstep. So it was quite a shocking experience for me when I saw such remote and rural places inside my home district, around the outskirts during my tenure at the project. And this just made me realize that there are so many people, young people, especially like me, who actually are not aware or do not know what the actual scenario and the actual problems of the people of our country is. They do not know that people might have to walk for more than 2 or 3 hours just to get basic level of education, or to go to the nearest market, or to get the first level of transportation, to get a bus to travel somewhere. So this was an actual eye-opening situation for me. And from then onwards, that's when I decided that, yes, I need to do something for these kind of people. I need to do something for this kind of community where there is actual need of knowledge, awareness, and creation of accessibility to resources and facilities based on health, because that's what I primarily worked on. And that's how I was always intrigued to learn more, to talk to the people in the community, know about their problems, and try to brainstorm and come up with innovative solutions to solve their problems. And just around the corner came the Youth Innovation Challenge, which served as the perfect opportunity to explore and develop ideas. And that's how ultimately SOCHAI was born. So yeah, I guess I always wanted to do something for the people in the health sector. And because of my academic background and my professional experience during the 2.5 years of UNICEF project engagement, I got the chance to learn and know and realize my actual passion about what I wanted to do in life. And because I was involved with SOCHAI, its inception, its development, I then went on to pursue a master's degree in food and nutrition in 2017. So yeah, SOCHAI has helped me to achieve my professional goals as well, and I'm taking my academic goals side by side in the sector of nutrition, along with working in SOCHAI.
Yeah, I'd like to come back, yeah, to this moment because I think it's really your eye-opening aha moment when you travel to all the provinces of Nepal in the rural areas and you discover basically how maybe life looks like and how it's different for Kathmandu. And yeah, I wondered, I think it's a moment where you really discover your why. You wrote on your bio that you are passionate about bridging the gap between people and their basic healthcare services, especially in rural areas. So yeah, maybe I'd love to come back to this exact moment. Like what happened after, were you clear on what you were supposed to do, how you could take action on that? And yeah, how did that lead to the creation of SOCHAI? Maybe, yeah, that would be great if you could walk us through a bit all the steps after you had this, realization that you wanted to work with people in the rural areas.
I think it just was a sequential sort of events, and I actually got to connect the dots for what I wanted to do in my life because of all those experiences and applying to the innovation challenge and then on to creating SOCHAI. Also, there was this one experience when in 2016 I also was involved in creating another organization called HAPSA, which stands for Health Advancement Programs in South Asia, with one of my US based doctor friends. And we also set up a primary healthcare center in one of the earthquake affected areas nearby to Kathmandu under that project. And there too I had similar experiences like in the UNICEF project, as in it was the area was merely a hour drive from the main city here in Kathmandu, but the people in that village, they had to walk for more than 45 minutes, almost about an hour, to reach the nearest health post or to reach the nearest primary care center to buy even basic level of medicines like paracetamol or to have first aid services. So that experience too was something that really intrigued me to think about why is it so that people who are a bit farther from the city or who belong to somewhat of a rural background have to take such long travels, or put in so much effort to just buy a simple tablet of paracetamol or to get first aid services, whereas it's according to our constitution and our basic human rights, it's imperative that we get access to basic health services under our radar, right? So this really got me to thinking that why there's this kind of disparity and discrepancy between the urban and the rural population, or amongst the privileged or people who have those sources, and compared to those who do not have those means or access, or are from a bit underprivileged, financially lower class uh, of families or communities. So that's why I always felt that services, facilities, firstly need to be reached out to those who do not have them under their radar, those who have to pay extra efforts or extra financial resources just to get basic services. Those people or those communities should be entrapped first, and that's how we can actually say that yeah, every citizen of Nepal has access to health services, or every person or every individual family can get a service of health and necessary amenities under their communities or their radar. So this was the actually the main motive, or main objective that drove my passion and drove my ambition in life, that yeah, something needs to be done to those kind of people and those kind of families at first, if we want to create a change, or if we actually want to see that Nepal's health status is going upwards in the coming days.
There's one thing that really I'm wondering is because you have this, when you speak, really, we can feel like you really have this, you want justice. And I wonder, like, where does it come from? Like, why? Like, I don't know how to ask this question, but like you've traveled to all the provinces, you've seen all the issues. Why does that make you? I don't know how to ask, but many people maybe might see the issues, they might not care, they might decide not to do anything about it. But so driven,
Yeah.
and you explain it so well. And it's also not, I mean, from what I understood, it's not your world. Like, you grew up in Kathmandu and you discovered about all these issues after the earthquake. So I wonder why are you so driven? Is there something particular about you that makes you really, okay, I saw this problem, I really care, I really want to do something about it? I don't know if the question makes sense, but yeah. Do you think there's something special about you, or something that makes you want to fight for those most left behind?
So I don't know why I was so driven, and like you mentioned, many people actually see it but do not care, or are not really so pertinent, or moved by these challenges as I was. I think there are some personal experiences and personal reasons that actually connect me so much to the issues that I mentioned. One of them being that my grandfather, I could not meet him in my life because he passed away when he was just 51 years old, and he passed away due to tuberculosis. And even though he was just 51 years old, and there were no difficulties for us, as in for our family, to have foods or regular medicines or health services, I think there was that awareness and knowledge gap regarding what kind of habits or what kind of diet one needs to have to become healthy and to prevent weakness in the long term, that can help you to fight diseases or even chronic conditions in the long term. So I guess losing my grandfather at such a tender age, because 51 is just the middle age, not for someone to lose their lives. And I think, yeah, this experience and the stories that I used to hear from my father about how he lost his life at such a young age, so yeah, this was something that always drove me, or enticed that force within me, that I wanted to get involved within the health sector and do something as a health professional when I grow up. And apart from it, one of the other experiences is that when I was visiting all these different areas post the earthquake, during my job tenure, I came across a middle-aged man in one of the villages, and he had brought his 3-year-old son to the health post where I was going for my routine inspection and field visit. And he told me that he carried his son on foot and walked for more than 1.5 hours just to get a small bandage on his son's head because he had a wound over there. So that's just primary first aid service. And the guy, he was wearing basic sandals, and it was really hot, and the child, he was bleeding from his forehead. So all these scenes just made me realize the kind of privilege that I grew up with, whereas there were also people like those who had to walk for such a long time to get just the basic enmity of health service. I think it also made me realize the kind of social injustice and the level of disparities we have between people of different classes here in our country. And I think it just, there was this moment of self realization that so many people are losing their lives and having to face an untimely death due to reasons as such, just because they were not so fortunate to belong to a privileged class with access to financial resources or health resources within their reach. And there's also another experience while we were piloting our bracelet in the community under SOCHAI. So we met a mother. I met a mother of three young infants. They were triplets whom I met in the community while we were just telling and introducing our bracelets to the mothers in the community. So this woman, she had two daughters and a son. Her triplets, after 10 days of the earthquake took place. And unfortunately, during the earthquake, her house had collapsed completely from the ground. They were living in a tin shed in a open field, and there were nine of our family members who were forced to crammed up and stay inside that tin shed. And because of all this, there were no proper resources for her to feed herself, and hence she was not able to breastfeed her infants properly as well. So as I was observing the triplets, I saw that her children, they were showing some early signs of stunting, as in their head and their neck part was kind of drooping, and their eyes were drooping. So I could see that the children were showing early signs of malnutrition. And that's when I talked to the mother, and she told me that she did not have any idea that she needs to exclusively breastfeed her children for the first 6 months, and she had started feeding them milk and formula after 3 months of their birth, because she was not producing enough milk for all three kids. And also, I think just realizing that mothers nearby to Kathmandu, even they do not have this level of knowledge that what kind of foods they need to feed their children, or why breastfeeding is so much important. So yeah, these kind of experiences, they just moved me to the core. And I guess that's why I got even more connected to my dream and goal of doing something in the health sector, and was so driven. And like you mentioned, this internal passion and force came from within me that, yeah, I need to do this, and this is what I want to change.
Now thinking about it, but you are like in, meeting all these people, hearing all this like terrible, really sad stories. How, like, do you manage? How do you? I already have questions. I am not sure how to ask because it's really not a thing I know. But I wonder, how do you manage to keep your own sanity or your own maybe mental health? And it feels like you hear and witness and observe so many sad stories, so many things that make you angry at the system. I wonder, like, how do you manage to, just not be angry all the time or be sad all the time, but manage to keep your sanity, keep your mental health, and just, move forward?
Obviously, listening to all these difficult experiences and the sad stories, and looking over all these hardships that people face, it's quite unfortunate, and you tend to question your existence as well at times, like, am I doing enough, or have I been successful to reach out to them or actually create an impact? But I think I feel that I'm very blessed to have a great team at SOCHAI and a great group of friends that we communicate on a regular basis. We share our stories and the challenges that we face in the community, and have this platform to free our mind, and speak about whatever issues or the feelings that we might be facing. And because of this open communication and sharing platform that we have, I think we have been able to tackle the challenges as a team, and also encourage one another to always be driven to our passion and driven to our mission and goals, so that we'll be able to put in more efforts and have a collective approach in solving these kind of problems. It's also been very helpful to create a close bond of friendship and professional relationship as well, so that you can support one another and give your inputs, feedback, or even critical reactions at times, so that one can improve their take, or creating some suitable solutions for their problems as well. And ultimately, this kind of relationship and this kind of open communication will help you to keep your mental health in check, and balance your sanity as well. So I think, yeah, having a group of well balanced team and supportive friends and team members has definitely helped me in this process.
Yeah, I feel like, when I was looking at Sochai, I really feel like the team is a very big part of Sochai. And yeah, about that, so you mentioned Sochai was kind of born from Youth Innovation Challenge. Do you remember the first day? Do you remember when, like, how did you see this call for application? And then what did you do to set up the team, set up the proposal? And then what happened next when you got selected and developed the bracelet? Like the first few
Oh,
days of
yeah.
Sochai.
Yeah. So our CEO, Bonita, she actually saw the grant and the innovation challenge, that it was open on the internet, and three of us, like Bonita, me, and Monjita, our other co-founder, we were actually connected via a local NGO here, which coincidentally is named Lifeline Nepal. So we used to gather at Lifeline for our monthly meetings at times, for the UNICEF project, to share our updates and stuff. And that's when Bonita shared that this kind of challenge is opening up, and she was thinking of applying, and she wanted to have a team assembled within that time frame that was announced for the application. And that's how we came together. And we chose the theme of malnutrition because for Nepal there were three themes, and we found that malnutrition was something we all connected very much, because we were primarily from health and social work backgrounds, and all of us really loved working in the community, especially with children. That's why we targeted malnutrition. And yeah, so there were different phases of mentorship during the Youth Innovation Challenge, where we were first given tasks and different challenges of team activities online, because the main judging team was in Malaysia. And week by week, we tackled those challenges, did our tasks, completed them successfully. And ultimately, when we reached to the final round, our team member Bonita got invited to represent SOCHAI as in our team from Nepal for the final event in Malaysia in Kuala Lumpur. And during that time, she was assigned with the task to, implement the given task in the actual community. So I remember in the final judging round, we met real mothers in the community and get their feedback back to the judging panel in Malaysia. And Bonita sent us the message that we need to do that. And three of us, as in me, Manjita, and Aasutosh, we went to a government hospital, which is a really big health facility. And when we went to the hospital that day, and we just stood outside the outpatient department, the OPD department of the hospital. We waited for the mothers to come in and talk to us, and we were just there at the door holding the bracelet. And we just stopped every mother who was passing by, requested her to listen to what we had to say, explain them the idea of the bracelet. And luckily for us, all the mothers, they were quite appreciative of the bracelet. They said that they did not have this knowledge from anywhere prior to listening to us, and they found it to be quite useful. And also that we were given a task to ask the beneficiaries, as in the mothers, that would they be willing to buy our innovation, as in the bracelet, for a nominal price. And thankfully, I think the mothers were quite impressed with our idea. All the mothers, they responded quite positively, as in all of them were quite appreciative, and they responded that they would be willing to buy our bracelet for a nominal price or a nominal charge, because this was the first time that they had the access to this vital information about nutrition and breastfeeding for their children. And this feedback was definitely a big boost for us and our team challenge. And I think it was also one of the crucial factors that led us to win the final round in the Youth Innovation Challenge. So I think with the simplicity of idea, the easy acceptance, and the quick reception and appreciation from the mothers was also one of the crucial factors because of which we won the Youth Innovation Challenge. So as I sit here to recall the memories of that time, it actually feels quite surreal, because we came in and started with zero expectations, but we actually went on to win the very first prize with such a simple idea, and beating 17 other countries from the Asia Pacific region. So that was a huge achievement for us. And with that win, I think we became a bit more confident and a bit more sure that, this idea is something tangible and can actually have an impact for mothers in the long run.
That's such a nice story. And just before we move on, I'd like really to emphasize two things for the listeners. I think what you said so far is like, if we just speak about, social enterprise or launching project, you mentioned two things that are really important that I just want to emphasize. The first one is asking, real people what they think, if they're willing to pay, because before you actually ask them, everything you think is just assumptions, and you need to test your assumptions. And I think it's so funny the way you did it. Like, Bonita went to KL, she realized it was one of the judging criteria. She was like, just send you a text, and you all just ran outside to the first hospital. And I think it's super entrepreneurial, I mean, and I think just shows how strong the team is to just support each other. And from your story, so there is this, like, your entrepreneurial skills and willingness just to go out and ask people, just even if you didn't plan for it, how strong is your team, and also something that you've done through your whole life. It's not something you've done just for the competition, but it's the understanding of the problem. It's something you have seen for a few years, and it's the first thing that we want to know is whether the team understand which problem they want to face. And in your case, and I'm sure the same for the other co-founders, but it's a problem that you have observed by yourself through working for the past few years. So you know exactly what needs to be done, what is the problem faced by people. And I think, yeah, that's good recipe to be winning this competition, like understanding of the problem, good team, and willingness to ask real people what they think. So I think there's a lot of lessons learned from your story, also from that could be applied to any sector, any product. So thanks for sharing this fun anecdote.
Thanks, Dean. Yeah, I also want to inform you that during the initial weeks of our mentorship, we were introduced with the concept of human-centered design thinking process while developing our innovation. And I think because we were able to empathize with our users and beneficiaries so much, I think our innovation went on to become so impactful and effective.
Yeah, definitely. And it's so important not to rush on the solution, but really empathize with the people. And I just have a random question, but actually the Youth Innovation Challenge, is it Generation Unlimited?
I think it was a different program altogether. I think there was this high level meeting of the leaders from the youth and sports ministry of different countries from the Asia Pacific region. And this used to happen in every 3 years. And yeah, the competition was open in 2016 when we won during that time.
Oh, okay. Oh, so you're actually the first winners ever of this competition.
I think so.
Cool. Thanks for sharing. So you won the seed grant. So you managed to produce more bracelets and reach more pregnant moms. And yeah, you shared a bit about the impact already. So yeah, I wonder, like, how did you then evolve from this first Nutribeads bracelet? How did you move from that? And I mean, you could have stick with bracelets, right? And just try to produce and support as many people as possible. But I know that you've developed then the red cycle bracelet to help track menstruation. And then you also have so many other activities as well. So could you share a bit, like, how did you like scale from this first bracelet to everything that you do now?
So after we won the Youth Innovation Challenge, we actually thought of creating an innovative approach in delivering our services part as well. And that's how we went on to develop the concept of training young people for delivering our education and awareness part. So the first thing that we did after we won was that we trained 25 young people who were primarily from health, medicine, social work backgrounds, and public health backgrounds. So these students, they actually have a mandatory requirement that they need to do some kind of voluntary and community work to complete their academic course. So we trained them and we mobilized them in our pilot implementation area. And the feedback we received, like I mentioned a while ago, that we did a pilot survey over there and we found that almost 83% of mothers had increased their knowledge level and had some kind of positive change on the breastfeeding and complementary feeding pattern for their infants. So this was also a huge encouragement for us to continue our work. And, that's how we started looking for more areas to reach out to mothers who required this kind of knowledge. And because $5,000 is not much of a significant amount, we used to conduct short-term programs at different areas. We used to reach out to different health workers and female community health volunteers who are the first go-to person in the community here in Nepal. So we gave and distributed our bracelets to the health workers and FCHVs in the community so that they could teach mothers and women in every community that they reached out to in future. And apart from that, in 2018, we also started our school based programs where we used to conduct 3 days of intensive training for students between class 6 and class 9 on different topics of nutrition, the advantages of balanced diet, and the disadvantages of junk food, because junk food consumption is quite high in both urban and rural areas here in Nepal, amongst school children especially. So that's what we taught them about, and also on hand washing and hand hygiene and different other aspects of basic healthcare. So our school programs and this concept of nutrition boot camps was also quite successful, and we got to collaborate with different other organizations like Dhulikhel Hospital and UNESCO to conduct our school-based nutrition boot camps as well. And in 2018, because we used to interact with so many school children during that time, we found that many of the female students, while we were conducting our boot camps, they would come to us and ask so many questions on menstruation, about what actually happens during menstruation and the kind of hygiene that they need to follow during this period. Even though menstruation is a part of our school curriculum, there are a lot of social stigmas and taboos associated with it here in our community because of the age-old customs and some of the religious myths that menstruation is a process that makes a female impure, and that she needs to have different kind of restraining habits and practices during this period. So that's when we thought that if we are talking to youth and adolescents and talking to them about or educating them about nutrition, health, hygiene, menstruation also needs to be incorporated. And that's how we developed the Red Cycle bracelet, which is another one of our innovations. So it's a simple bracelet, again having 28 beads, which represents the 28 days of average cycle of a woman's monthly period. And the bracelet, simplifies and explains the overall process of menstruation, as in the 5 to 7 days of bleeding, the day of ovulation, the most fertile period during the cycle, as well as about premenstrual syndrome, about the changes that happen during this time, both the physical and hormonal changes. And apart from that, it also has a small tracker with an elephant on it, which can be moved to track your cycle. As well as with the elephant having it there, we're trying to preach out to the girls that menstruation is a completely natural process and they should take it as their strength but not as a weakness, because it is the first step to their reproductive life, and it is the first step for them to start to create another life on this earth. So that's why with this bracelet we've always tried to disparage the myths and the negative practices that are prevalent here. We encourage girls to speak up about these practices and normalize it completely. Also, while we do these classes on MHM or menstrual hygiene, we make sure that we include the boys classmates as well, because ultimately it's the male members as their brothers or fathers or even husbands in the future who need to support their female counterparts during this crucial period of their cycle. So in this way, we started conducting these school programs and they started the distribution of Red Cycle as well. And during this process, even though we started out with a mission and goal of being a non-profit organization, we came to realize that winning grants and conducting projects from donations or grant money is not a very sustainable approach. And that's how we thought that maybe we can sell these bracelets to people who can buy them and generate funds to conduct our community programs. And that's how the idea of entrepreneurship, I think, actually flourished within our minds in the team. We came up with the concept of buy one, give one, as in whenever our buyer buys one bracelet, we use that money to give one bracelet for a mother or a adolescent girl in the community for free with our counseling. And in this way, I think SOCHAI just transitioned from a non-profit organization to a non-profit social enterprise, wherein we thought of being donor independent and creating sustainable sources to conduct our community programs in the long term. And even during this time, because we were not quite sure about how we were going to move forward, we had not registered officially here within our country's ecosystem. But in 2019, we were successful in winning another international global grant called the Lead 2030 Challenge. It's held by One Young World, which is a famous UK-based nonprofit organization. And the idea of our Nutribeads bracelet again won the Lead 2030 Challenge for the SDG goal number 2, zero hunger. And since it was a global grant, it was of a larger scale and had bigger remuneration as the prize money. We were very lucky that we were the only team from Nepal that was the winner in the challenge, and we beat over 1,200 participants from over 100 countries of the world and won $50,000 for our programs and our mission. And that's when we decided to officially register as a non-profit company here in our country's official system. And from 2019, SOCHAI has been operating as a social enterprise, a non-profit company, wherein we sell our bracelets. We also apply to other grants side by side. And with this dual approach of grant money and the selling of our bracelets, we collect funds and collect resources to conduct programs at schools, to mothers and women in the community, as well as programs for health workers and the FCHVs. And this model, I think the buy one, give one model has been quite successful in creating a niche for SOCHAI as one of the prime youth organizations. I think it's actually the only youth organization in Nepal that's working in nutrition.
Cool. Thank you so much for sharing all of that. I think so much things I want to come back to. Maybe the first one is, I think it's very interesting the way you try to reach grassroots areas, because you mentioned you have different entry points, right? You mentioned the training all the youth who have to, in their curriculum, to do some volunteering work. You mentioned the community health workers. You mentioned the project with UNICEF. You mentioned working with schools. So I think, yeah, it's very interesting the way you're just trying to reach more, rural areas, but through all fronts, through all these channels. And yeah, I find it very innovative. It's very interesting because you identified every actor that has a role in addressing this issue and just work with them. I find it very comprehensive and innovative. And the second thing that I found interesting in what you just shared is also the transition from being purely donation-based to developing your own revenue stream by selling bracelets. And yeah, just want to highlight, if anyone is listening and want to support SOCHAI, you can go on SOCHAI website, order some bracelets. I think I check and you do international delivery. So yeah, everyone, you can support SOCHAI by purchasing some bracelets as well. Really love the approach, like just trying to work with all the stakeholders and also developing your own revenue stream. And really congrats on One Young World. I think that's very prestigious award. So yeah, no, I think that's super nice. Thank you for sharing a bit the timeline and history and achievements of SOCHAI. And what are the next steps for SOCHAI now? Now that you're registered, you got this award from One Young World, what are your next things that you'd like to do in the future?
Yeah, firstly, thank you, Din, for giving a shout out to our work across to your listeners. And thank you so much. And yeah, so currently through SOCHAI, we're primarily targeting three age groups or three group of beneficiaries. First is the pregnant and lactating women and their children. Second one is youth and adolescents, primarily through our nutrition boot camps and youth trainings that we conduct for school children and college students, like we have been doing, and creating a pool of youth volunteers that would work for nutrition, health, and hygiene through SOCHAI. And the third one, it's a relatively new concept, and it's still in its pilot phase as of now. So, in the third beneficiary group, we're trying to reach out to different women who are enrolled in the community based mothers and women's group. So, we have these Ama Samuhas and Mahila Samuha, and which means mothers and women's group in our community who are engaged in conducting different trainings and have awareness programs on health, and also conduct some cooperative finance activities in grassroots levels. So what we're trying to do now is we plan to train these members of these mothers and women's group on a skill based activity linking agriculture and nutrition, so that they will be able to create resources of food sources that are vital for a woman's nutrition, especially during pregnancy and lactation period. Small food resources to start off with, and we what we plan to do is brand their products and connect them to a organic and unique type of market here in the urban areas or in the major cities, so that they will have a source of higher revenue for their products and also have a sustained source of income to improve the life of their families, as well as to purchase more nutritious and healthy foods for themselves as well. So currently we are in the first phase of implementing this pilot project of skill-based trainings linking agriculture and nutrition, where we've trained a few women in the community on mushroom farming, and there have been some positive results as of now. So most certainly it has have been disturbed due to the ongoing COVID crisis. But yeah, we look forward to connecting with them more, and coming up with even more innovative technologies such as value addition through solar drying to existing food products that they produce, or even training them on producing food sources that are high on nutrient value, or explore some local grains that have high nutrient value but are not really utilized, or are underutilized because people are not really aware of their nutritious value or the worth that they carry. So yeah, we're currently under the exploring side of this, and our product manager Eva is taking the lead on this part, and we're quite excited to see the results, as in what kind of products or nutritious foods that we'll be able to produce through this approach of social entrepreneurship, and the kind of feedback we'll receive from our buyers and the local market here. So yeah, quite excited and looking forward to it. As for Team SOCHAI, I'm currently operating as the director of programs, wherein I look after, plan and manage the overall community programs that is being done from our team. We currently have 3 projects under our belt. So through our Lead 2030 prize money, we're conducting a 2-year program in 2 different provinces at 2 different municipalities currently under the Youth for Nutrition program, where we reach out to all the 3 beneficiary groups that I mentioned before: the pregnant and lactating mothers, youth and adolescent, and women members of the mothers and women's group. With this, we're utilizing innovation, education, and entrepreneurship to create and go towards or achieve the goal of women empowerment, and ultimately to eliminate zero hunger, the SDG 2 that we primarily focus on. Apart from that, we also conduct many organizational collaborations, as in many organizations working here in the sector of health, hygiene, and nutrition purchase our bracelets and distribute it to their beneficiaries at different areas. And apart from that, for our internal revenue generation and revenue pooling, we're also developing different wellness and nutrition sessions and programs targeted to corporate houses and organizations for their staff welfare, wherein we teach them about basics of nutrition, wellness, BMI calculation, and the kind of foods, resources, and balanced diet that they need to have on a day-to-day basis. So yes, we're currently growing, and even though COVID has impacted our goals and on-site programs, we also focus on digital advocacy, as in we try to come up with interesting content on nutrition. We create some funny and short animation videos, which has been highly appreciated, which are based on breaking the menstrual taboos and empowering breastfeeding in public places. So you can also check that out on our YouTube and social media. And apart from that, we also share vital information on nutrition facts, share nutritious recipes, and also relevant information on COVID prevention as of now. So yeah, it's currently a busy situation as well, and I think it's a growing phase for SOCHAI in terms of product development and revenue generation too.
Wow, that's crazy. I mean, just thinking everything started from Bonita seeing a post on Facebook and now winning the grant. And now I'm just thinking how it's growing so much. Good luck on this incredible journey. Thank you for sharing all of that. I think
Thank you.
sounds so exciting. And I'm just wondering, like, it sounds like you will need to work all the time, 24/7. I just wonder, do you ever feel, overwhelmed, or do you ever feel tired? Just that there's so many things happening. And what are your secret tips to maybe get some dose of energy or to recharge your batteries?
Um, Yes, of course. I mean, I'm also human, and with so much of workload influx, it gets to me at times, because obviously there's physical exhaustion as well as mental pressure to be performing at your highest level at all times, and especially because you are dealing with one of the most vulnerable and challenging groups, that is the pregnant and lactating mothers. You need to be careful and cautious about how your programs are being operated or run, and how the services part are being implemented, whether you have all the products required to be sent out to the community standby. So yeah, there are different challenges that come with it, but I think as I mentioned previously too, that we have a very strong team with individual roles assigned to each members, and thankfully very fortunate to have such a great team with me, who support not just in the day-to-day operational and professional task, but as well as there's this environment and platform to share your personal problems and issues, or the things that might get to you during your work. So yeah, I think what I would advise, or maybe just would like to share with all young people or your listeners, is that it's important that you have that room for clear and open communication amongst the people that you work with, because even though there might be someone who is in the top level of leadership, or even if someone is just a volunteer or at the starting phase of his or her career, it's important that you share your ideas and share about your challenges, talk about your problems, and this sort of sharing should be there, and the room for open communication should always be there if you want to build a strong team and also maintain your sanity while implementing your life and professional goals side by side, because uh, I also believe in this saying that if you want to go fast, you go alone, but if you want to go far, you have to have a team, right? So, if you're looking to be successful in the long term and have a sustainable and a strong team with you, I think it's important that you also make the effort to communicate and look after the people that you work with, not just when it comes to their professional life, but their personal life as well. And yeah, please always be open and have that room for communication and platform to for each and every member of the team to speak out and feel like they are actually being heard and valued. And I think apart from that, yeah, never stop learning. Please always have that zeal to explore, research, and learn new things every day, because there's still so much to be done in the world, and there's still so much to learn, and problems to be solved. So yeah, keep yourself at your toes and work and tackle every day with an open mind.
No, and I feel it's a reflection of your, I guess, of your life philosophy too. And on that, so I have final 3 questions for you. Questions I always end with. And one is really linked to what you said. I wonder, we spoke a lot about SOCHAI, about Lifeline, not the podcast, but Lifeline Nepal. And your dream to be a doctor when you were younger. I wondered, who is Neha, but, not related to SOCHAI or health? How would you describe Neha?
Yeah, so that is kind of a tricky question. So I think, yeah, Neha is just a simple girl, a simple person who is always very keen to learn and listen to other people. And I think she's quite empathetic by nature, and uh, she's always very observant to listen to other people and learn from their experiences, and maybe even implement those life lessons in her journey as well.
And deep question coming. How would you like people to know you and remember you for?
Yeah, I think yeah, I think I would like people to remember me as someone who loves to work in the community and loves to devise innovative approaches to solve problems, especially related to health and nutrition in her surrounding.
I guess you already reached this level, right?
Yeah, I still am in the journey, because there is a lot more faces and a lot more mothers who need this kind of knowledge in my country, and it's just the beginning for me. There's a long way to go.
Okay. And yeah, how would you describe yourself in 3 hashtags?
Okay. The 3 hashtags would be hashtag kind, hashtag empathetic, and hashtag changemaker.
It's so interesting because you remind me a lot of another guest I interviewed, who was also my colleague. I interviewed her twice, actually, for episode 1 and episode 25. And she also put kind in her hashtags.
Oh,
and
okay.
one interesting thing that I talked with her in the second one, episode 25, is we are reflecting a lot. So her name is Linka, and we are reflecting a lot on how to create empowering environment for young people. A bit of what you mentioned before, and empowering environment for us, it's like very transparent environment and very safe environment where people are safe to speak out, are safe to learn, are safe to share about their stories. But most of all, for us, we tried to see, okay, what is, if we had to highlight one important, maybe the most important element, it's where people are kind and where people are trusted. Because one thing we noticed is youth have so much power, but many times either they don't trust the power they have, or either they are in a disempowering environment where the environment itself don't trust them. So
Yeah.
and then they just tend not to trust themselves either because no one trusts them. Oh, you are too young, blah, blah, blah.
Yeah.
And we were reflecting, that in our programs, many youth, they organize workshops, they do public speaking, they develop their leadership skills, and they do things. And they always tell us, oh, I never thought that I could do that. And we
Yeah.
always tell them, actually, yeah, we supported you, but only what we did is just trust you that you will be able to do it and just provide you a safety net just to make you sure that you are in a safe space. So even if you do mistake, it's okay. But what we only did is to trust that they had already this inner power within themselves and that they're able to do it. And then they start to trust themselves and unleash this power. And then they start to be amazing even more. And yeah, no, it made me think a lot about being kind to people, which means to trust them in what they can do. And yeah, then she was sharing about her kindness philosophy, like what does it mean to be kind, etc., etc. So yeah, you can, you can listen. It's very interesting. But yeah, no, it makes me
Yeah.
think a lot about your open communication, speaking up, be transparent with your team members, whether you're a volunteer, whether you're a CEO, whether you're whoever. And yeah, no, I think that's a
Yeah.
great way to end the conversation on
Yeah. I
this
think,
positive note.
yeah, I do agree with what you said, because even here in our country, youth are usually, the power of youth is very much undertapped, and even from the administrative or the government level, the situation or the environment is not very encouraging for youths to come out or do something on their own. But I think we as change makers need to take that initiative and uh, be confident and keep moving on the mission or the dream that we carry, because uh, as long as we're confident and we're willing to invest on our dreams, I think that's when we see the results, and then on we start getting the confidence to actually go and chase our dreams. So yeah, it's very important for youth, especially from coming from a setting and environment like ours, that they need to battle this inner demons that they have in them, and this underconfidence or lack of confidence, or even the imposter syndrome that it's usually termed, I think, to go out there and keep moving and be resilient on the path that they have chosen for themselves.
Did you feel the imposter syndrome with SOCHAI at
Yes,
some
of
point?
course, many times. Even now, sometimes I have to deal with it, because, since we're working with the health and nutrition sector, it's directly linked with the programs, health programs of the government, and we time and again have to go and talk to health officials at the government level or the Ministry of Health. And like you said, people do not take the things that youth or young people have to say very seriously, and it's tough to crack that between the bureaucratic hierarchies that we face on a day-to-day basis. And
Yeah, there was this challenge for us as well as a team because the concept of our bracelets were not taken very seriously before the Lead 2030 challenge win, and before we were covered extensively by our national and local media here. But after that coverage and our Lead 2030 challenge win, I think that's diminished to a bit, and we've become a bit more confident when dealing with even government and administrative bureaucrats.
Hmm. Yeah, no, I think thanks for sharing this aspect as well, because, hearing your stories and all the things that SOCHAI do, I think, yeah, everything is perfect. They're doing so well, but you also have your moments of doubts and you're working on it. Maybe just a real final question. uh, where, where should, people contact you? Why should they contact you, and how can they contact you?
So if anyone who's listened to the podcast and is willing to get in touch with me or contact me, I think you can just send me a Facebook friend request. It's my name, Neha Malla. You can find me on Facebook or on Instagram as well as Malla Neha 9, MALLANEHA 9, the number 9. And apart from it, you can always know about SOCHAI's work through our social media pages. Just look up SOCHAI, or even through our website if you're willing to contribute or collaborate in any way with SOCHAI in the future. And I think you should contact me or reach out to me because I'm always eager to learn and know about new things, and eager to learn from people and their experiences. As I said, that I'm very empathetic and observant by nature. So if you feel like doing something when it comes to the sector of nutrition and health, or even youth and volunteerism, I think we'll have a similar mindset, and I'm sure we'll be able to brainstorm to collaborate in some way.
Cool. And also contact her to tell her how amazing her story is. And actually, I had a real final. I say that all the time, but that's a real one. I just wondered, like, does your name mean anything?
So my name is derived from the Sanskrit word sneha, which means affection. So it means affection or affectionate.
Okay, cool. Oh yeah, but it's really it's a perfect word to summarize your whole story, actually.
Oh, thank you.
But no, cool. Thank you so much for your time today. Listeners will not know because I will do the editing magic, but we had so many tech internet issues. But we made
Thank
it.
You.
So nice to meet you. Thank you so much, Neha. And everyone, please send her messages to tell how inspiring she was.
Thank you, Din. It was really nice to talk to you as well. And I look forward and hope to talk to you and communicate with you in the future as well. Thank you again.
Congrats for listening until the end of this episode. And as always, you can support Lifeline by sharing this episode with your friends, by subscribing, or by writing a nice comment on Apple Podcasts. Thank you so much, and see you next time.